Are you walking out of doctor appointments feeling unheard, dismissed, or like you didn't get the care you deserved? If you are over 60 and nodding your head right now, this video could change everything about your healthcare experience. I am going to reveal the 7 biggest mistakes that are sabotaging your medical appointments, and more importantly, exactly how to fix them. Look, getting older should not mean getting worse healthcare, but here's the reality. Many seniors are unknowingly communicating in ways that work against them in medical settings. I hear from so many of you in the comments saying things like, "My doctor rushed me out," or "They didn't take my pain seriously," or "I felt like I was just wasting their time." This is not okay. And it is often not entirely the doctor's fault either. Sometimes, it is how we are presenting ourselves and our concerns that is working against us. Today, we are going to fix that. By the end of this video, you will know exactly how to advocate for yourself, get better care, and leave every appointment feeling confident that your voice was heard. You will have specific scripts to use, preparation strategies that work, and the confidence to demand the healthcare you deserve. Mistake number 1, being too accommodating. This is probably the biggest mistake I see. You walk into the doctor's office and immediately start with, "I don't want to be a bother, but," or "I know you are busy, so I will be quick," or my personal least favorite, "I am probably overreacting, but." Stop right there. You are paying for this appointment, either directly or through your insurance that you have been contributing to for decades. Your health matters. Your concerns are valid, period. Here is what happens when you start apologetically. You are immediately putting yourself in a subordinate position. You are telling the doctor that your time and concerns are less important than theirs. And unfortunately, some doctors will unconsciously treat you that way if you present yourself that way. I had a viewer, Margaret, who told me she used to start every appointment with, "Sorry to bother you, doctor." After changing her approach, she said her doctor actually started spending more time with her and taking her concerns more seriously. Instead, start with confidence and clarity. Walk in and say, "Good morning, doctor. I have 3 main concerns I would like to discuss today, and I have written them down so we can use our time efficiently." Notice the difference? You are being respectful, but also assertive. You are showing that you value both your time and theirs. You are coming prepared, which doctors actually appreciate. Write your concerns down beforehand. Prioritize them, most important first. And here is a pro tip. If you have more than 3 concerns, either book a longer appointment or schedule a follow-up. Do not try to cram everything into a standard 15-minute slot. Your health is not a burden, it is the exact reason you are there. Own that. Mistake number 2, using vague descriptions. "I am feeling a bit off lately," or "something doesn't feel right," or "I have been having some discomfort." I get it. Sometimes it is hard to put into words what you are experiencing. But here is the thing. These vague descriptions do not give your doctor enough information to help you effectively. Think about it from their perspective. They see dozens of patients every day. If everyone says, "I don't feel good," how can they distinguish between someone who needs immediate attention and someone who just needs reassurance? They cannot read your mind. They need details. I once had a viewer tell me her doctor diagnosed her with anxiety when she said she was feeling weird. Turns out, when she went back with specific symptoms, she had a thyroid condition. Specifics matter. This is where the PQRST method becomes your best friend. I want you to write this down. P stands for position. Where exactly is the problem? Do not just say "my stomach." Is it upper abdomen, lower right, around your navel? Q stands for quality. What does it feel like? Is it sharp like a knife, dull like a bruise, throbbing like a heartbeat, burning like fire, or cramping like a muscle spasm? R stands for radiation. Does the pain or sensation travel anywhere? Does it stay in one spot or spread? S stands for severity. Rate it on a scale of 1 to 10, where 1 is barely noticeable and 10 is the worst pain you can imagine. Be honest, do not downplay it. T stands for timing. When does it happen? How long does it last? Is it constant or does it come and go? What makes it better or worse? Let me give you an example. Instead of saying "my back hurts," you would say, "I have a sharp stabbing pain in my lower left back, about 4 inches above my hip. It shoots down the back of my left leg to my knee It is about a 7 out of 10 when it is bad. It happens every morning when I first get out of bed and lasts about 20 minutes. It gets worse when I bend forward and better when I lie down. See the difference? Now your doctor has something concrete to work with. If you are finding these insights valuable so far, please let me know in the comments below. And if you haven't subscribed yet, I recommend you subscribe so you don't miss any future videos. Now let's move forward to mistake number 3. Mistake number 3, not speaking up when something feels wrong. This one really gets to me because I hear about it so often. You know your body better than anyone else on this planet. You have been living in it for 60, 70, 80 plus years. You know what is normal for you and what is not. But when the doctor seems to brush aside your concerns or gives you an explanation that does not sit right with you, too many of you just accept it and walk out. Maybe they say, it is just part of getting older, or let us wait and see when you know something is genuinely wrong. Maybe they seem rushed or distracted. Maybe you get the feeling they are not taking you seriously. Here is the truth. Your instincts are often right. Studies show that patients who feel heard and validated by their doctors have better health outcomes. But more importantly, you have the right to feel confident in your care. Trust your instincts and be respectfully persistent. Here are some scripts you can use. Doctor, I understand your assessment, but I know my body, and this does not feel normal for me. Can we explore other possibilities or run some additional tests? I appreciate your explanation, but I am still concerned. What else could be causing these symptoms? I would like to get a second opinion on this. Can you provide me with my test results and notes? Before I leave, I want to make sure I understand. You are saying this is normal, but it is impacting my daily life. What are our next steps if this does not improve? Do not be afraid to be the squeaky wheel. Polite persistence often gets results. And remember, if you are not satisfied with one doctor's response, you absolutely have the right to seek another opinion. Your health is too important to leave to chance. Mistake number 4, minimizing your symptoms. It is probably nothing. It is not that bad. I don't want to make a big deal out of it. Sound familiar? You are essentially doing the doctor's job for them by deciding what is important and what is not. But here is the problem. You are not the medical professional in the room. What seems minor to you might be a red flag to your doctor, or what seems catastrophic to you might be easily treatable. Let them make that determination based on the facts, not your interpretation of those facts. I have heard so many stories of people who downplay chest pain as just indigestion or dismiss persistent fatigue as just getting older. Sometimes these things are minor, but sometimes they are not. Why take that chance? Present the facts without editorial commentary. Be a reporter of your own experience, not the judge and jury. Instead of, I have this little cough, it is probably just my allergies acting up. It is really not that bad. Say, I have had a persistent cough for 3 weeks. It is dry most of the time, but sometimes produces clear phlegm. It is worse in the morning and occasionally wakes me up at night. It started right after I got over what I thought was a cold. See the difference? You are giving them the information they need without pre-diagnosing yourself or minimizing the impact. Another example. Instead of, I am a little more tired than usual, but I am sure it is nothing serious. Say, I have noticed a significant change in my energy levels over the past month. I used to be able to climb a flight of stairs without getting winded, but now I need to stop halfway. I am also falling asleep during my afternoon TV shows, which never used to happen. Let your doctor decide what is significant. That is literally what they went to medical school for. Mistake number 5, letting others speak for you. I see this happening more and more. Your adult child, spouse, or caregiver comes with you to the appointment, which can be great for support. But then they start answering all the questions about your health and your symptoms. Mom has been complaining about her knee, or dad hasn't been sleeping well, or she seems more confused lately. While they mean well, they are giving secondhand information. They do not know exactly how your pain feels, when your symptoms are worst, or how your condition is affecting your daily life. Your perspective on your symptoms is irreplaceable. When someone else speaks for you, you are not getting personalized care. You are getting care based on someone else's interpretation of your experience. Speak for yourself whenever possible. If you need or want support, establish ground rules before you go into the appointment. You can say something like, I would like to answer the doctor's questions first, then Sarah can add anything important I might have missed. Or, I brought my daughter for support, but I want to make sure my voice is heard first. If you are dealing with memory issues or feel overwhelmed, you might say, I am going to do my best to explain my symptoms, but I have asked my son to help fill in any gaps. The key is maintaining your agency while still getting the support you need. And for those of you whose family members are watching this, please let your loved ones speak first. Your role is to support, not to replace their voice. You can add details or advocate for them, but their first-hand experience of their symptoms is crucial for good medical care. If you are still watching and these tips are helping you, please comment below to let me know. And make sure to subscribe if you haven't already, so you don't miss any of our healthcare advocacy videos. Now let's continue with mistake number 6. Mistake number 6, not asking follow-up questions. The doctor gives you a diagnosis or prescribes a treatment, and you just nod along like you understand everything perfectly. But inside, you are thinking, what does that actually mean? Or how is this supposed to help? Or what if it does not work? Then you leave the office feeling confused, worried, or uncertain about what comes next. Maybe you get home and try to Google your condition, which often just makes you more anxious. Here is the thing. Doctors sometimes forget that they are not speaking to other medical professionals. They use terms you might not understand, or they explain things too quickly because they are running behind schedule. But it is your right and responsibility to understand your own health care. Never leave a medical appointment without understanding your situation completely. Here are the essential questions you should always ask. Can you explain this diagnosis in simple terms? What exactly is happening in my body? What caused this condition? Is there anything I could have done differently? What are all of my treatment options? What are the pros and cons of each? How long should I expect this treatment to take? When should I start seeing improvement? What side effects should I watch for? Which one should I call you about immediately? How will we know if the treatment is working? What should I be tracking at home? What happens if this treatment does not work? What is our plan B? Are there any lifestyle changes I should make to help with this condition? When should I schedule my follow-up appointment? Is there anything I should avoid while dealing with this condition? Do not worry about taking too much time or seeming difficult. A good doctor wants you to understand your care. If they seem rushed, you can say, I know you are busy, but I want to make sure I understand this correctly so I can follow your instructions properly. And here is a pro tip. If you are feeling overwhelmed by all the information, ask if you can schedule a follow-up call with a nurse to go over everything again. Mistake number 7, not documenting everything. You think you will remember everything the doctor said, but let us be honest. Medical appointments can be overwhelming. There is a lot of information coming at you, maybe some of it is scary or unexpected, and your mind might be racing. By the time you get to the parking lot, you are already forgetting details. Was it 3 times a day or twice a day for that medication? Did they say to call if it gets worse or only if it gets much worse? When exactly are you supposed to come back? This is not just inconvenient, it can be dangerous. Missed instructions can lead to ineffective treatment or even harmful mistakes. Document everything, and I mean everything. Here are several strategies. First, bring a notebook and pen to every appointment. Start taking notes the moment you walk in. Write down the diagnosis or working diagnosis, all treatment recommendations, medication names, dosages and timing, side effects to watch for, follow-up instructions, when to call the doctor, and any test results or numbers they mention. Better yet, ask if you can record the conversation on your phone. Most doctors are absolutely fine with this, and it ensures you do not miss anything. Just ask, would it be okay if I record our conversation so I can review it later? If you are feeling overwhelmed or emotional during the appointment, bring someone with you specifically to take notes. Give them the job of being the secretary while you focus on communicating with the doctor. Here is another strategy. Before you leave, read your notes back to the doctor or nurse. Say, let me make sure I have this right, and go through your understanding of what was discussed. This catches any misunderstandings before you leave. And finally, ask for written instructions whenever possible. Many doctors can print out information about your condition, medication instructions, or care plans. Do not be shy about asking for this. Before we wrap up, I want to give you 3 bonus strategies that will absolutely transform your medical appointments. Create a 1-page health summary. This is a game changer. Create a single sheet of paper that includes your current medications and dosages, your major medical conditions, recent symptoms you have been experiencing, allergies and adverse reactions, emergency contact information, and your main concerns for this visit. Hand this to your doctor at the beginning of the appointment. They will love you for this because it gives them all the essential information at a glance, and you will love it because it ensures nothing gets overlooked. Schedule appropriately. If you have multiple concerns or complex issues, do not try to squeeze them into a routine 15-minute appointment. When you are scheduling, be honest about what you need to discuss. Say, I have several health concerns I would like to address. Do I need to schedule a longer appointment or split this into 2 visits? Most offices can accommodate longer appointments. You just need to ask. It is better to schedule properly up front than to feel rushed during your visit. Follow the 48-hour rule. If you leave the appointment and realize you forgot to ask something important, or if you are confused about the instructions, do not wait until your symptoms get worse or your next scheduled visit. Call within 48 hours. Most medical offices have phone consultations or nurse callback services. Use them. Say, I was in yesterday and forgot to ask, or I want to make sure I understood the instructions correctly. This prevents small issues from becoming big problems and shows that you are engaged in your healthcare. Look, I know this might seem like a lot to remember, but here is the truth. Your health is your most valuable asset, and you deserve excellent care at every age. You have earned the right to be heard, understood, and treated with respect. I want you to pick just 1 or 2 of these strategies and try them at your next appointment. Do not try to implement everything at once. That is overwhelming. Just pick the ones that resonated most with you and start there. Then come back and let me know in the comments how it went. Did you feel more confident? Did your doctor respond differently? Did you get better answers to your questions? I read every single comment, and your experiences help other viewers too. If this video helps you feel more empowered about your healthcare, please share it with someone who might need to hear this message. Maybe it is a friend who has been frustrated with their doctor visits, or a family member who does not advocate for themselves. Together, we can help more people get the healthcare they deserve. What other healthcare topics would you like me to cover? Maybe navigating insurance, preparing for surgery, or dealing with specialists? Let me know in the comments below, and I will see you in the next video. Take care of yourself. You are worth it.